Dear attendees, I would like to inform you that our webinar will start in 5 minutes. Please stay tuned. Hello everyone, I hope you are all keeping safe. Welcome to today's webinar and thank you for taking time out of your day to attend this online event. Remaining true to its mission for the last 15 years, ISNR Abu Dhabi is organizing webinars in collaboration with its partners to promote the latest innovation in the fight against COVID-19 virus and the actions to mitigate its effect on people and society. These webinars are meant to reinforce the public-private people partnership through an interactive editorial-led format concentrating on valuable insights, sharing information, and maintaining content integrity. On behalf of the UAE Ministry of Interior, ISNR Abu Dhabi organizers, our distinguished speakers, and you esteemed audience, I would like to take this opportunity to convey our utmost gratitude to the unsung heroes of the crisis, the worldwide medical staff, and the frontline healthcare workers who are in the eye of the storm, battling the virus spread and lowering its fatality rate. My name is Pierre Haddad. I am the founder of the Review Middle East, a security content consultancy concentrating on resilient communities capable of mitigating losses related to day-to-day business, technology challenges, as well as natural and man-made disaster. Managing risks and technology response during the COVID-19 crisis is the title of the ISNR Abu Dhabi first webinar, where technology and knowledge partners join us to present their solutions and thoughts in the fight against the pandemic. Experts from ESRI, PwC, and Etisalat Digital will engage the topic from their organization's perspective. Today's event will start with ESRI, followed by PwC, then afterward with Etisalat Digital. At the end of the webinar, we will run a live Q&A session. If you have any questions, start it by typing the speaker's brand and your question in the chat box. Your questions will be answered by the relevant speakers. If time does not allow, the remaining questions will be answered post-event at the speaker's convenience. At the end of the presentation, a survey link will appear in the chat box. We would love you to click on it and fill the small form that will enable us to collect feedback. If you missed anything during the presentations, do not worry. We will be sending around the on-demand recording as soon as it is available. When disaster strikes, ESRI Disaster Response Program is here to support you 24/7. Our first presentation will highlight the contribution of ESRI solutions in the fight against the COVID-19 virus. The presentation will be given by Ryan Lanklos and Carl Beck. Ryan is the Director of Public Safety Solutions at ESRI, where he is responsible for strategic initiatives across public safety and national security. He serves as ESRI's subject matter expert on GIS for emergency management and humanitarian response, and leads ESRI Disaster Response Program that provides 24/7 GIS support to organizations during the disasters. Carl is ESRI's Business Development Executive, working with ESRI distributors to enable users in defense, intel, national security, and government agencies in the WAMENA region to make the best use of the RG solution. Gentlemen, location intelligence changes the dynamic of the fight against the COVID-19 virus. Ryan, can you tell us how Disaster Response Program is enabling the concerned authorities and organizations in managing the present crisis, maintaining continuity of operations, and increasing resilience for long-term recovery? At the same time, I would like to ask Carl on how ESRI Enterprise Solution actions are empowering the authorities in achieving their objectives. Any examples of the applications that have been deployed globally and in the Middle East region?
Well, hello, everybody. My name is Ryan Lanklos. I'm the Director of Public Safety Solutions here at ESRI, and I also have the chance to lead our disaster response program, which we're going to be talking about today in the context of responding to this global pandemic that we are under for COVID-19. With me today is my colleague, Carl Beck, who works in the Middle East as our National Security Business Development Executive. He'll be sharing a bit more specifically of how we're supporting the Middle East area with solutions and technology supporting COVID specifically. So we're happy to be with you. Thanks for joining us today. So for those who may not be familiar with ESRI as a company, we've been around for more than 50 years, and we're founded with a mission to support and serve you as our users globally. We are a privately held company that builds software many of you may know as ArcGIS, but we provide also training and technical assistance. But truly, we were founded to make a difference in the world and solve difficult challenges using geography, right? The science of our world that we say, as well as the technology of GIS to truly make a difference. Why that's important today in COVID-19 is that for the last 25 years, we have a disaster response program that has been supporting crises and disasters of all types and all sizes internationally. It started more than 25 years ago with an earthquake in Southern California, and quickly, as you can see now, as we are today, supporting this global pandemic, delivering technology and support to you as users, as well as to those who are looking for different ways to approach this problem in a global pandemic at a scale that many of us, and I would say all of us, had never experienced before. We want to make sure that you know how to find us should you need assistance after today. And you can simply go to esri.com/disaster and at request assistance for either software or help implementing that, or more importantly, technical support if you have applications that are running in mission critical operations today. We want to make sure that you know that we're here to be with you, to stand with you and support you during this time of crises. So back in March, Esri made the decision to donate our software globally to anybody and everybody who needed access to GIS technology to fight COVID-19. This started with just a simple donation of our capabilities for a six-month window that involved ArcGIS Online, which is our SaaS platform you will see today in action, but also tools that help you dig deeper into data, right? From an epidemiological perspective to understand the spread, to model how this virus is moving globally, as well as solutions that can help you quickly jumpstart very specific things, from either collecting data in the field to gaining better situational awareness, or truly taking that modeling idea to scale and understanding across your country how things may be moving and the impact that that's having on the capacity of both the workforce, but also the health professionals that are out there and their tools that they use daily to make a difference in this fight. And we've seen to date more than 3,800 organizations reach out and ask for assistance in that. In fact, that brings with it about 18,000 very specific requests for assistance, for data, for applications, for support using ArcGIS. These are just a few examples we're going to share with you today from both in the Middle East with Saudi Arabia, but also through Asia with India, you see, and into the African continent with Rwanda and Ghana and others who are using these tools to understand both mapping the viruses, looking at the spread, and also as we're all tracking the curve. Are we truly flattening the curve, or are we still in the middle of the spread? So what I'm most inspired by is the work that you are doing as a community, and we just want to share some of that good work today, and also to make sure that you know where to go next as we get into the short-term recovery and then longer-term recovery aspects of where we need to be in the next several months and years to come for our world to fight this pandemic. So why is Esri in this conversation? For many of you that are familiar with Geographic Information Systems, or GIS, you're familiar with the tools that are used daily to support many different types of operations, from managing infrastructure at the city level or national level, into this case, fighting a pandemic. And we do that by using these tools to observe phenomenon in the world, right? To put lines on the ground to represent streets or buildings, or to understand infrastructure like pipelines and networks. But we also understand how those things start to interact together. So we certainly can start to look at how interdependencies and these layering of information come together to expose new patterns in the phenomenon that we may not have experienced before, just through spreadsheets and data that are not geographically located. But that allows us then to quickly put a plan into place to respond to what we see. And that response may be just simply how we want to apply dollars or mitigation funds in a public safety aspect to, in this case, how do we apply dedicated resources into the fight against COVID-19. So this process, this framework of using GIS to measure and map and visualize, to eventually model and understand and analyze, put plans into place, and then to act, is what is so key to making data-driven decisions and science-based decisions that can truly change the nature of the fight. So when we apply that framework to COVID-19 and the response that we see, we're seeing a tremendous amount of work being done for measurement of everything from not just caseloads, but certainly looking at demographic profiles of the characteristics of both the populations at risk, but also how we communicate more effectively to those populations and where we should communicate to those populations, certain interdictions and measures of the like. But we also can look at modeling to understand the forecasting and the impacts, and then start to plan around where we distribute resources, PPE, personal protective equipment, and others, eventually into how do we engage the community to make sure that everybody stays connected to the story that's evolving, truly delivering the data to those residents and folks that are in the world looking for this information to understand what it means personally to them and their community. So if we take that concept and that GIS process and framework, there's also two really important concepts that we're seeing come to play with COVID-19. One is that for the first time, many organizations are having to integrate new types of data to expand modeling into new epidemiological worlds that they may not have experienced before. While many GIS professionals are probably experienced with spatial modeling at its core, you can use those same tools to understand the spread of this disease. And we can also integrate all these different types of data that are coming at us from both the tabular data that we're familiar with and the population we discussed, but also things like mobility, looking at data about movement of the population. So where people are staying at home more, are they still out in the community? Looking at resources coming in real time from hospitals or facilities, and truly our social distancing measures that are being put into place having an effect or the intended effect based on the models that we see. But being able to bring all those together from your partner organizations, from your different departments within your organization, and using GIS to begin to integrate them into a map can change the conversation. And why is that? The reason that's so important is that because that map that integrates all of those different data types suddenly becomes the single point of truth that can allow you to deliver very mission-specific applications across your organization. That could be everything from, again, the data visualization and exploration needed to understand the spread, or to get better situation awareness in the operations center for your daily briefings and planning periods that you're working, all the way down into allocation of resources based on that modeling that you see coming out of the GIS, and truly communicating that back out to your constituents as well as your workforce to collect more information that can feed back into this cycle and continually work through the framework or the process of using GIS to respond. You know, these applications really are the building blocks of a system that allow you to not only respond to this pandemic today, but also set us up for the reopening and recovery that's needed in the coming weeks and months ahead. So if we look at that in action right now, what we see around the world out of those organizations such as yourselves that are doing tremendous work, we are seeing it provide situational awareness. You see applications here from the private sector, from the universities and research sector, from the global multinational organizations like the World Health Organization and others who are using it to provide authoritative content related to where cases are being mapped at the national level and subnational level to be able to record the spread of this disease and reporting that analytically through these curves and models. It's a tremendous amount of work here. This is probably the most common pattern that we are seeing emerge for COVID-19, is just for better real-time situation awareness of the data itself. And moving quickly beyond just looking at points on a map, people are starting to use these tools as we described for modeling, truly understanding based on where those demographics are located, the models that we see talking about the surge capacity of hospitals as well as mobility data can start to provide projections of where we think this disease may spread within communities. The two screenshots on here are certainly looking at curves, as where capacities and when capacities in terms of date and time may be exceeded. And more than importantly, just where date and time, but where geographically within the whole context of your environment, that capacity may be exceeded, because we know that not every area of our organizations, not every area of our communities, and not every area of our nations are the same. The vulnerable population, the at-risk populations certainly vary. So using these tools allows us to geographically target very specific interventions that could have a true impact on the spread and the curve rate that we see in this disease. And finally, just to understand at those populations at another level, so more than now understanding where, but once we understand where the curve may be spreading, how do we truly provide interventions that are impactful? So understanding exactly the profile and the population that we have at hand within very specific targeted areas, and what are the characteristics for those interventions? Do we need to provide more or less resources to our community? And because there's going to be multiple hotspots, if you will, of where aid is needed, how do you determine priorities of where to allocate limited resources? Well, we can use tools like location and to allocate resources geographically, to distribute resources into the community that are very targeted based on where that model shows that there is a spread, where the population is most at risk, and where access to care may be limited. That truly is the way that we can make a difference, is to target the in-person, the residents, the citizens, the community that actually needs that resource, more importantly now, more than ever. So what we'd like to do now is take a look at a level down. So that is framing and context of who we are, why we're here, and what we've started to see. Tremendous amount of work in the community. But I'd like to turn over to Carl to actually take us down a level. We have these 10 specific steps that we think are actions that are able to truly make a difference. And we'd like to share with you some specific solutions that can immediately be put to play that we think can help you as you begin to think more geographically about responding to COVID-19. So I'd like to turn it over to my colleague, Carl Beck, at this time. Thank you, Carl.
Thank you, Ryan. So what I'd like to do now is go through the actions and objectives that ArcGIS enables our authorities and organizations to achieve. So first of all, we want to be able to map the cases. We want to be able to find out where are the actual active cases, the deaths, and the recoveries to identify where the spread has occurred. We want to be able to map the vulnerable populations. We know from numbers that COVID-19 disproportionately impacts certain demographics, such as elderly and those with underlying health conditions. So we want to be able to see on a map where we can expect to have more cases in the future. We want also to be able to map the capacity. Where do we need to put more facilities and testing centers? Where do we need more equipment, goods, and PPE, and so forth? We want to enable organizations to analyze the situation here, to perform triage on medical test results, and to identify risk households and vulnerable communities, to track the impact of the spread, and to see where we need to sort of make a further effort. The fifth objective that we're trying to achieve here is to be able to map the spread over time. So we have time-enabled maps that can reveal how infections have spread over time, and where we need to target in the future. If we go down in the lower right corner here, this all feeds into our wish to be able to plan the response. We want to find out and identify which hospitals are at capacity maximum and which neighborhoods need additional resources. So we can take action and we can monitor the situation. And once we monitor the situation and we have a good understanding of what's going on, we want to enable organizations to communicate that information to the public as well as to the workers. This finally feeds into the 10th action that we have here. We want to be able to predict the need. So what I'm going to show you now are a few applications that have been pre-configured as part of the ArcGIS Enterprise solution. And the first one you see here is a configuration of the Survey 123 app. Basically, we want to enable organizations to collect data from citizens and from call-taking centers. And this allows people to self-triage or self-assess if they need to seek further treatment, or if they need to self-isolate, or if they need to just stay and do nothing further, if you will. All this data will then feed into the portal, the ArcGIS portal. And from here, authorities can monitor the situation. They can see the results of the test. You see here in the left bottom corner, the red part of the data are the people that need further treatment. The orange, the people that need to self-isolate, and the green and the blue part of the cake here are the people that don't need to take further action. And all this data is fed into the portal, allowing health authorities to see by gender, by age, by nationality, what's really going on in the field. You also have a map here of the location of these tests being taken, And you see in time, this is time-enabled, how things are developing. Another application that we've made available here is an application that allows to analyze the demand allocation for medical facilities. Basically, we want to be able to make sure that we place new testing facilities at the right location where you have the most cases. And for the public, we have dashboards like the one you have seen, probably many of you have seen the Johns Hopkins dashboard. This is an on-premise dashboard that basically allows also the authorities to communicate specific authoritative data for each country. And this is as well time-enabled, meaning people will have the best possible situational awareness at all time. And finally, we have an application here that allows medical staff to update the status and the capacity of all the medical and testing facilities, so that the authorities at headquarters have a good understanding of what is going on and where they need to build further capacity. So these are just some of the applications that are available and can be deployed within a short time should the need arise. So I'll hand it back to Ryan, but first of all, but lastly, I would like to acknowledge all the good work that is being done here in our region and globally as well to fight COVID-19. Over to you, Ryan.
Yeah, thank you, Carl. I appreciate that. And thanks for taking the time to show some of these configurable applications. You know, our hope for today is number one, just to help you understand more about how to apply the science of geography, the technology of GIS to the problem of the pandemic, to show you that there are solutions to get started today. And if you have questions of that, our disaster response program is there to stand beside you as a partner through this trying time. And just to echo what Carl just said, you know, your work is what's making a difference. The more that we can enable you and support you, the better off we all are. And so thank you for what you do. Thank you for making a difference and for truly inspiring others by sharing your good work and examples with the world. You know, and I say that sincerely to both the first responders that are in the field and the practice, but also to the medical workers, those that are working in the hospital front lines. You are truly making a difference, and we are truly honored by what you do. So thank you for that. And we'll close today by just saying we appreciate the time this morning and look forward to the other conversations as well. Certainly reach out anytime, esri.com/disaster for assistance. Thank you very much.
Ryan and Carl, thank you for this informative presentation. Please take some time to go through the stored questions in the chat box. Prepare to answer the ones you choose at the end of the webinar. Here I would like to encourage the audience to benefit from this Q&A opportunity to acquire more knowledge on the subject matter, securing the remote working infrastructure. Our second presentation will highlight PwC solution to secure the surge in remote working during the COVID-19 crisis. The presentation will be given by Simone Vernacchia. Simone is a partner in PwC Middle East and the Digital Infrastructure, Cybersecurity and Resilience Advisory Lead for the region. Simone has spent more than 10 years in the Middle East and North Africa region, creating, establishing, growing and leading the digital infrastructure and cybersecurity consulting. Today, the world is subject to self-quarantine, social distancing, and remote work. There is a high chance that remote working is here to stay, for a lot of people, of course. Simone, what are the issues companies are facing in the GCCs and how to put in place a secure remote working infrastructure?
So, thank you very much for having me here. My name is Simone Vernacchia. I'm a partner in PwC. I focus on digital infrastructure and cybersecurity. Before I start my presentation around securing the remote working infrastructure, I would like to spend a little bit of time to thank all the years that have been working in the medical field in fighting the current pandemics, which is definitely something that every one of us should be grateful for. Okay, so let's start with basically what we are discussing about today. It's mainly 4 points. We have around 15 minutes, so we'll try to keep it in quite short, but we'll be able to take some of your questions as we go. So we will start with an overview of the current situation resulting from the pandemics and what does it mean from a technology infrastructure perspective. So what kind of stress, what kind of security issues, and what kind of infrastructure impacts are coming from there. We will then define a little bit on how it's possible to basically set up a remote working infrastructure, which is secure and it's working. And basically, we will then move to some case studies. So if we start from the start, there has been quite a lot of changes which have been impacting the way we work, and thanks or due to the current situation. Basically, especially in the GCC, a lot of the activities before were reliant on physical interaction. So this was mostly a cultural, but also, I would say, some kind of business requirement for quite a while. The reality is that before this whole thing started, less than 10% of the people were actually working remotely. They were usually flying around. There was a huge reliance on office space as a way to interact with people and to work with co-workers. And in most of the GCC economies, some of the VoIP systems or the VoIP solutions were actually not allowed, either for business or for personal usage, unless there were specific tools which were basically used for that. It was probably one of the regions in which regional flights were more common from a business perspective, and there was probably one of the lowest traction in the adoption of the public cloud. There was private cloud, so it's not that the cloud was not there, but it was just very contained as a phenomenon if compared to what is happening in other parts of the world. Now, reality is, in the last months, we have seen a huge shift in the way these whole things have been carried out. Now, on one side, most of the countries have been lifting any kind of reduction or ban regarding the VoIP technologies. On the other side, there's been a huge amount of virtual interaction. Only Microsoft was reporting around 5 times the meeting minutes which were passing through solutions like the one we're using right now. And basically, the flights have been completely closed, which has been adding to everything that we've been discussed before. And in a way or the other, overnight, a lot of the organization and most of the biggest government entities and commercial organizations were actually shifting from a mostly localized and physical interaction to a complete remote kind of activity. Of course, beside the few real workers who had a necessity for being in proximity with the facilities. Okay, so how is this impacting? Well, there are 3 major current trends that we are seeing. On one side, there has been a burst in whatever is technology adoption for digital. And basically, this has been, somewhat under the eyes of everyone. A lot of the people who are following us today have probably been experiencing this. On the other side, because of this, there has been a lacking of capacity, around the world when you're moving from a real on-site, on-prem infrastructure to something which is happening in remote. Now, these impacts on the infrastructure have been happening at different levels. This means that, for example, it happens at the level of connection, meaning that you may have a problem in connecting your home office with the office, with whatever you actually have on the back end. On the other side, on the back end, since the remote workers were less than a minority before, right now there has been a lot of rush in basically increasing the capacity. In some cases, and this we have been seeing in some of the government entities across the GCC, there has also been a problem in managing the hardware, because in some cases there was a need for actually procuring new infrastructures which were required for increasing the capacity. On the other side, in some cases, the workers didn't have a real remote infrastructure. They didn't have, for example, laptops or mobiles. And for some of these workers, there was a need to basically rush in procuring the right kind of equipment for keeping them working. Now, there are things which were coming with these trends, and things which were somewhat stressing the overall population of workers in the GCC. On one side, of course, the shift of the practice. So you're used to basically interact with your colleagues, side by side. You used to look at the same video, and now you need to move to a situation in which you basically need to do it over a network and over a remote interaction. On the other side, basically, there has been a need for a lot of organizations, especially the ones which didn't have the right hardware for basically making this thing happen, to either finance or support the workers in setting up their own infrastructure and eventually in using their workplace technology, which was either coming from them, like personal devices, or somewhat less managed by the company or the entity because of all the difficulties in dealing with remote devices and the fact that people were required to access from remote in a very short time frame. Now, something that is quite interesting to notice is that with the old pandemics, as it usually happens, there has been a rise in attacks. Now, we know that around 95% of all the cybersecurity attacks which have been carried out in the last years has been starting with one common kind of activity, which is called phishing. It's basically the practice of sending you an email which is designed to abuse you, either because there is a link to be clicked and some information to be collected by pretending to be a different website, or because there is a malware. Now, what we've seen in the market and what a lot of vendors, and different organizations have been reporting is a huge increase of the kind of attacks which have been done in the last period. This is because, of course, attackers are opportunistic and they are basically trying to use the fact that all of us are rushing to help in one side or to work in a new way as a way to penetrate networks and to exploit users. And basically, this is what we have been seeing. Okay, so once we move from this, we are starting looking at how a traditional workplace used to be working, and now that can be moved to a remote workplace or to a kind of remote infrastructure. Now, if we look at how the typical office was working before the COVID-19, there were two different worlds. One was the world of the internal office workers. These workers were having laptops or workstations which were completely controlled and which were not meant to be brought outside of the internal network, if not in very exceptional cases, in very exceptional occurrences. So basically, what was happening before is that internal clients were fully under management. There were some internal servers and there was an extranet. All internal servers were basically protected from a perimeter perspective and protected with devices which were actually attested on the same exact network. On top of this, almost all the services which were designed to support office workers were actually hosted inside an internal network, either virtual or physical, and they were somewhat all connected in one or more DMZs. So basically areas which are, from a perimeter perspective, connected, secured, and basically which are controlled from an inside and outside, kind of traffic. The reality is that, of course, there were already, remote workers. Of course, there were already people who were using their own facilities or their own solutions to basically connect, but they were just a minority. And this is what you see in the top left of the screen when you see VPN connections. It's not always a VPN connection, but in most of the cases in the GCC or in the clients we've been visiting in the last period, this was more or less the case. Now, the reality is that having to move to a remote infrastructure, you need to rethink what you've been used to do, in the last years. And how do you rethink this? Well, as a first point of reference, the reality is that the moment you move to remote working, a lot of the perimeter and a lot of perimeteral security somewhat loses traction and loses interest. Why is that? Because a lot of the people that you've been working with before in a secure environment, now they are moving to the wild. They're moving to their own connection, and they're moving to their own, to the internet, basically. This means that a lot of the clients that you used to control and you used to be a very good monitoring about are now sitting somewhere else. They may be coming with bring your own device kind of initiatives. So they may be the kind of laptops, tablets, and mobiles that are not owned by the company, but they're owned by the users. And basically, because of this, your level of trust of these devices needs to be strongly reduced. Now, what we've been seeing a lot is adoption in this last period of MDM and MAM technologies. Now, MDM, basically, or mobile device management, and MAM, or mobile application management technologies, are solutions which are meant to limit what user can do with their devices. Now, what does it mean? It means that you are providing a layer of security on the device which can be also put in devices which are not owned by the company. Now, how are these things helping? Is basically these are limiting the way the user can actually install software which is potentially malicious, and reducing the way it can actually use data which is confidential to be shared. Now, these old technologies are relatively fast to be implemented, and we have seen this being rolled out in less than 1 month in some of our clients, and we've been working on that quite aggressively. On the other side, there has been a trend of moving solutions to the cloud. Why is that? It's because if you really want all your workers to be connecting through a VPN to your internal network, this is resulting in two things. First, you're increasing your risk of getting malware. On the other side, you are increasing the requirement on hardware and network connection on your own offices. Now, the reality is that if you move to solutions in the cloud, and we are talking, for example, about Active Directory or Office or other solutions which are meant to be workplace enablers, but they are not on-premise anymore, you are basically reducing the workload and the bandwidth that you are requiring in the office. And this is resulting, of course, in a cost reduction. Now, cost reduction, of course, with the oil prices and all the initiatives that the governments are putting in place is a topic. And this kind of remote architecture is basically enabling a lot of cost cutting and a lot of reduction in infrastructure and cost.
From technology perspective, can you give us some examples of most affected sectors in the region during the COVID-19 crisis?
Yes. So definitely, and thank you very much for the question. Now, reality is that, of course, a lot of impact, a lot of economical impact have been affecting hotels and has been affecting restaurants and HoReCa businesses. What we see from a technology perspective is that a lot of the impact has been in the main GDP providers in the region. This includes, of course, the government, but it also includes whatever is oil, gas, and petrochemicals, and it also includes whatever is financial services. We will see in a bit a couple of use cases on how the impact has been changing the face of the way this kind of entities are working. So after answering this question, I would like to move a little bit on the cases that we have here. Of course, they are quite simplified on one side to maintain the anonymity of our clients, on the other side to basically show what is really relevant, in 15 minutes. But the reality is that we are super happy to have any kind of question just after the session. So basically, one of the industries that we have been seeing impacted the most is basically what is oil, gas, petrochemicals, and utilities, which is, as I said before, a major contributor of the GDP in the region. Now, the reality is that, especially in this kind of entities, which are usually, safety intensive in the sense that you need to basically take into account that an attack or a cybersecurity attack can result in physical consequences. Basically, the typical way of working before the COVID-19 was that every single plant was isolated from the external world and isolated from a network perspective. What we've seen in the last months is that a lot of these plants, just to make sure that the human interaction is basically as limited as possible, have started to employ data diodes or solutions which are basically allowing only the outbound flow of data versus the inbound. Why is that? Now, a lot of the activities that a typical safety engineer or a typical operational technology engineer is doing is basically looking at events and monitoring what's going on in the plant. Now, thanks to this kind of solutions, you can have the events coming to your devices outside of the plant, but you cannot really go and work on the plant. And even if you have a malware in your own devices, this is not impacting the way the plant is operating. Basically, this is one part of the story. The other part of the story is that plants, even before, were actually providing VPN access to be managed remotely by vendors. Now, the reality is that a lot that we've seen in COVID-19, in this new situation, is that way more of the management has been done remotely. But on the other side, there has been an increase in the level of security of this remote management. There is two technologies which are key in this. The first one is strong authentication. It's basically making sure that everyone who is connecting to the plant remotely needs to be authenticated using different levels of authentication. This usually includes something which is a password or a passphrase. and either a certificate or some other kind of device to be authenticated. Can be a VPN token, can be even an OTP SMS. The reality is that this is one part of the story, so guaranteeing that the person who is connecting is the right person. On the other side, the point is that there has been a surge in usage of privileged access management and privileged access control kind of solutions. What are these solutions doing? It's basically they're doing two things. The first one is they're putting themselves in between the person who is doing the management and the management console. They are basically checking that the person is actually who is supposed to be. But more than this, they are recording everything that every single session is actually doing. And eventually creating alert if something is done, and it's matching the rule. Now, these two technologies are basically allowing us, on one side, to make sure the person who is connecting is the right person. On the other side, they're allowing us to have full tracking of what every single person is doing in the plant, and basically giving the possibility to audit this and to store it in different systems from the systems on which the person is administrator, so that they cannot be tampered with. The second example that I want to bring you, of course, once more, very simplified, but we are super happy to have any question and to reply to any question that you guys may have. Basically, it's about financial services. Now, financial services, mostly banks in the region, have huge infrastructures, and because of their security requirements, they used to have all the workers which were engaged either in any payment or in trading or in anything which is either performance or security intensive to be working on premise. Now, in the COVID-19 era, as we know, there has been a lot of limitation on the possibility of getting to offices, and thus we have been called to basically solve this problem in many different instances. Now, one is the one which is depicted in this picture. The reality is that to preserve the performance, but still to allow people to be connecting from outside, one of the technologies which has been employed the most is VDI technology. Now, what this technology is allowing you to do is basically connecting to your workstation from remote. Your workstation is still sitting in the office, which means that it's still, somewhat enjoying the same level of connectivity, security, and performance that it was having before, but you're using your own machine to connect to that. Now, the moment you connect, once more, you use strong authentication to connect, exactly like we were saying before. But on top of this, your own device, your laptop, your tablet, or whatever you're using to connect to your VDI server is basically only used as a dumb device, meaning that even if you have a virus, there is no way for that virus to basically be replicating itself throughout the network inside your office space. And once more, this is a compromise, can only be used in some specific areas, but it's allowing you to preserve performance on one side, because the reality is that your workstation is still sitting in the office, and also security. I hope this was useful. Thank you very much for watching, and we are very happy to answer any questions you may have about what we discussed so far.
Simone, thank you for your explicative presentation. Please take some time to go through the stored questions. Be prepared to answer the ones you choose at the end of the webinar. Once again, I would like to encourage the audience to benefit from this Q&A opportunity to acquire more knowledge on the subject matter. Please do not forget to complete the survey form that will appear in the chat box at the end of the webinar. Our third presentation will highlight Etisalat Adaptive Solution in facilitating the task of the UAE concerned authorities in their quest during the COVID-19 pandemic crisis. This presentation will be given by Ms. Maha Muraish. Maha is the VP Data Value Creation and Robotics at Etisalat Digital. She helps public and private sectors to take their first step to digital transformation via robotic process automation and continue the fueling of the digital transformation journey to reach its intelligence peak by transforming the data into insights that enables them to spot opportunities and predict trends for better decision making. Hi Maha, can you tell us about Etisalat Adaptive Solution and its initiatives from data perspective, of course, that has assisted the UAE authorities in their fight against the COVID-19 virus spread?
Okay, so Again, thank you so much for having me as part of this important event. And before I start, I would like to have a small thank you, or to pay a small contribute to our heroes, the world medical staff, for helping us on the fight with the COVID-19. We are definitely proud of all of the efforts being given by the medical staff, as well as whether locally and internationally, as well as all of the local authorities actually helping us with this event, or to help us with the fight itself. So what I'm going to be doing in here today is that I'm going to take you through the solution that Etisalat have worked on to help the COVID-19 and provide to the health authority the capability to be able to fight it. But the way we are doing it is completely from a data perspective. So as you can be able to see, or we have seen in the various sides of the world, there's a lot of initiatives, and a lot of countries have put various controls and various measurements to be able to fight the disease in different ways and fight the virus in different ways. Whether from China by analyzing the medical sets, putting the app for a color coding and tracking, locking down cities, all the way to the US for creating or utilizing the spider queries and for the virus spread models that they have created. The UAE also and proudly stating that they have created, or they have looked into a lot of countries and controls and initiatives to be able to help the COVID-19, whether it's actually from the containment policies, the measure for the lockdowns of the Emirates, the Fort app, that actually has been launched very recently, 2 weeks back, for a color coding and so on. But there's also another capability that Etisalat has put in place in order for us to be adding to the community, because this is part of our community responsibility and our country responsibility to be able to contribute to help the society when it comes to helping the control of the COVID-19 and the fight for the COVID-19. So as part of that responsibility, we have created Adaptic Solution. And Adaptic is a short for Analyze, Detect, Prevent, Track, and Control. And the idea in here is that the solution itself, it's a mashup between different data sets. This is data sets that is coming from Etisalat itself. As a telco, we do have a lot of telco data that can be able to, or mobility data that can be utilized very nicely when you mash it up with the different records of medical records or the medical set records to be able to create a different or a massive solution like the one that I'm going to be explaining to you. So Adaptic itself, it's an end-to-end solution that provides the authority or the health authority the capability to analyze, detect, prevent, track, and control the pandemic or any unpandemic disease as well, whether it's actually the COVID-19 or even a flu, or even the flu. The same concept can be utilized as well, so that the decision maker in the health authority be able to utilize this data to be able to take actual informative decisions based on the data that we are showing. The solution itself, it analyzes the medical sets and enable and define and predict the severity of the spread based on the COVID cases and based on the quarantine cases. We can be able to understand where they're coming from. We can be able to understand if they are living in a very heavy populated areas. We can be able to understand all of that information and put it to understand exactly what is the risk factor for each and every zone, for each and every community, in order for us to be able to see where the outbreak is going to be happening. Then we have the detect model, and this is actually whereby We looked into the possible infected cases using AI decision trees in here for color coding of possible cases. And based on that, the health authority can be able to utilize this information to be able to call for those cases and ask for an actual test proactively instead of after the symptoms is being showing on a specific case. Then the prevent model, and this is, again, we're working on a proactively capability to define and control how we can be able to contain the spread. And this is by putting a risk factor on each and every zone and each and every community. So what we're doing in here is that we can be able to color code a specific area, and we can be able to give it a score in terms of how risk is this area in comparison to the other, by creating different factors. Such example for that, if the area is highly populated, this would actually increase the risk factor for this area to have a high risk zone. If the area is, for example, or there's a COVID case that's been found in that specific area, or a COVID case that's been established or quarantined established in that specific area, that would actually increase the high risk zone. If there were travelers that have traveled to contaminated countries, this would actually, in that specific zone, will also increase the high risk of that zone. So all of that different parameters is actually added into that specific areas or the specific parts of the country and the Emirates itself to be able to put a risk factor to say, this is an area that has a high risk zone. The other part is related to the tracking. And in here, what we're doing is that we are being able to understand, based on a specific COVID case, 14 days backward, i.e. we go historically backwards in 14 days and understand exactly the journey of these cases. Based on this journey of these cases, we are being able to understand the people who came into a proximity into that person, for how long they have came into a proximity to that specific case. The same thing, we can be able to define where are the areas that was mostly exposed to that specific case, and based on that, we can be able to find out who are the exposed. We can be able to give them different coding. It depends on how long they have been exposed to that specific case, or a confirmed or a positive case. And based on this, then we can be able to, again, understand how the spread or where the outbreaks was going to be happening. And then again, the health authority can be able to take a proper decision to understand if I need to mobilize specific clinics to that specific areas, or if I want to be able to create a lockdown, virtual lockdowns to that specific zones, they can be able to do that. We also, part of that tracking capability, we also have the capacity to be able to understand the containment policies, i.e. people who actually stays at home, people who have still mobilized, still actually doing all of the mobility part. So we can be able to understand exactly how that mobility and the containment policy, if it requires to be changed, if people are adhering to these policies, if it requires to be changed in a specific zone, because that specific zone is considered to be high risk, then again, the health authority can have the capacity to be able to utilize this information in order for them to be able to take a better decision when it comes to that. The beauty of all of this is that we're doing all of that, taking all of that different indexes, adding it into what we call a dashboard that provides a 3D map. It actually works on the GIS capability and GIS AI location, that we can be able to put all of the data on top of it, and given the capacity, again, to the health authority to see in real time, in real life, exactly what's happening, where the outbreaks is going to be happening. They can be able to understand exactly where are the risk zone areas. They immediately can be able to create geofence. They can be able to lock down virtually any specific zone, create a containment policy differently to a specific zone than the others in order for them to control the spread. This is what Adaptic is all about, and there are 3 main modules for this. The mobile app that we have, which is given to all of the users that we have, i.e. to all of the citizens, that's me and you. We can be able to register for the app itself. We can take the self-assessment. We can be able to get the results of that self-assessment. We can be able to get our QR code that can be able to help us to move. If we are green, then we are moving freely. If we are red or yellow, then we are restricted in our movement. All of that is actually integrated to the capability that we have, which is the big data engine that we've got, with all of the data that Etisalat also have, to be able to create all of these indexes that I've just talked about right now, and everything is added into a virtual or a visual dashboard that gives the authority the capability to take a decision immediately on the spot. The mobile app, as you can be able to see, it has the capacity of various capabilities and features into it. It goes all the way from single user registration to a family registration to self-assessment to QR codes to NFC Bluetooth, in order for us to be able to understand who came into a proximity to whom, so that we can be able to understand exactly who are being exposed and for how long they have been exposed. And then also we use the QR codes as a way for mobility freely, or mobility in a controlled manner. If I am registered, or if I have received a color code based on my self-assessment, a red or a yellow color code. That is all of that information is actually that we generate from that application is added into our big data engine, and it's actually added and matched into our data as well, so that we can have a better indexes and a better probability of what we can be able to provide.
Maha, how successful was Etisalat web application as a threat intelligence platform in influencing the response plans of the different UAE public safety agencies?
Thank you, Pierre, for the question. So as you can see, when it comes to Adaptive solution itself, the two main module for the solution itself is the web app application, which is actually pretty much the prevent and the track and the control modules of the application itself is actually into the web application itself. In there is a lot of indices that we are using in order for us to be able to understand where are the outbreaks that is happening, where are the risk zones that is actually going to be, and based on that we can be able to color code it in the map. So let me take you through what we're doing with the data itself and how we are creating the different indices so that we can be able to help the authority to take a much better decisions based on these indices. So one of the things that we're doing, for example, is the exposure index. And this is a very important index because it actually looks backwards historically on any COVID case and understand based on a proximity and based on a time duration, how long any person was exposed to that COVID case. This is very important in here for the health authority to be able to understand it, because then they can be able to plan themselves in terms of the capacity for the hospitals, for the beds, for the doctors, the medical staff that they require, the vaccination that they require to need, the medication that they require to provide. So it's very important that they can be able to understand, and also instead of them actually testing the whole complete emirate, they can have the capacity to be able to test those who are being exposed to a specific COVID case. So this will give them the capability to control the situation further, being able to control also the supply or the medical supply that they need. So that this index will be able to help them a lot from that perspective. There is also another way that we're looking into this. Again, this is whereby the zone or creating or understanding the different zones within the UAE itself, and understand or provide it with a risk score based on various parameters. So, for example, if this zone is considered to be highly populated, this risk zone have too many COVID cases, for example, in that specific areas, or too many quarantined cases in that specific areas. If there were a lot of travelers have traveled to a containment or countries that contaminated, or it has a high contamination risk factor, then all of that is actually added together, and then we give it a score. Based on that score, we can be able to color code that zone, and we can be able to lock it down virtually. So whoever actually have in or gets out of that specific zone, the health authority, they can be able to be alerted. This is, again, very important because they can be able also to create containment policies that is completely different into high-risk zone areas than the one that is considered to be green zones. And again, since I'm talking about the green zones are considered to be safe areas. So as it's important for us to highlight or to put a risk factor on dangerous zone, it's also very important for us to put risk, how low is the risk factor to a specific zone, or where are the safe zones that regular people, i.e. Healthy people, have the capacity to be able to freely mobilize in these areas than the ones that is considered to be red. And then they can be able to understand where they should go and where they should not go. And utilizing this color codes also will help the health authority to be able to understand if I'm starting to see there is expansion or more spread, because I'm starting to have more red areas moving a bit by bit to the green zones, or no, I'm actually being able to control the situation and I'm starting to have a risk factors that shows me that that the green areas are starting to be more than the red zones, and hence I am doing the correct measures that I need to do and the control measures that I need to do in order for me to be able to control the situation. Other parts that we also providing is the lockdown indexes. This is also very important, is that based on the various high-risk zone, we have the capacity based on these maps to be able to create what we call a geofence. Geofence is a virtual fence that we create on any specific, whether it's a high-risk zone or even a green zone, it does not matter. We can be able to create it as virtually, and then people can be able to understand before they even enter to a red zone, to be able to say you are almost coming to a red zone, please go backwards so that they don't get into it. Or if they are coming to a green zone, then they can be able to say you are coming into a safe zone, please continue your mobility. So this way we can be able to inform the citizens where are the areas that they need to be not to go to, or the areas that they can be able to freely move into, again, to help the health authority to be able to understand and to ensure that the mobility of each and every citizen in the UAE, how they should move and where to should move freely and safely at the same time. We're also looking into other indexes like the vulnerability indexes, the risk scores for travelers, the containment index as well, which is actually measuring the population of the mobility with the respect with the containment. So if I know, for example, this is a very highly populated areas, and there are also a lot of mobility is happening in that specific area, so there could be an outbreak that may have because there is a lot of mobility. There is no containment policy is being controlled in that area, or there is more measures that we need to put in that specific area, because this area itself is considered to be a business area. This area itself is highly populated, so there should be a different completely containment policies that is related to that specific zone. So all of these indexes are actually added into the 3D map that we have in different color codes, helping the different health authority to be able to have better controls, better measures, more effective way of controlling the spread and the outbreak in that area. So this is what we're doing in relation to how we are helping, or what we are using as extra precautions and extra measures to help the health authority to be able to take that decisions, or to be able to take more proactive decisions, if I may say.
Maha, thank you for this valuable presentation. We are so proud of the UAE achievements. Please go through the stored questions. Be prepared to answer the ones you choose at the end of the webinar. Dear audience, do not forget to complete the survey form. It will appear in the chat box at the end of the webinar. Okay, now is the time to take ownership of the knowledge and information we have shared with you during the webinar. We invite all attendees to participate in our live Q&A session. Due to time limitation, 2 or 3 of your questions will be answered by each of our valuable speakers. We're starting the session with SDA expert. Gentlemen, the first question is, let me check it out. The first question is for Ryan. Are the Esri tools free for download? How do we access them? Ryan, the floor is yours.
Yes, thank you, Pierre. So thank you for the question. Certainly there are 2 ways to access the tool. So one is, I mentioned in the presentation that we have made the technology of ArcGIS available complementary to anybody who needs access to fight COVID-19. And you can do that simply by going to esri.com/disaster and request assistance. We'll gladly give you a 6-month complimentary access, and that comes with a series of solutions and tools, as we spoke to, that are freely downloadable, configurable, that you can begin to take ownership of and launch. Now, the important part is that is meant to be deployed in our SaaS cloud that's available both in European cloud space as well as in US-based cloud, depending on your selection. The second part of that was that we did show some more specific applications detailed for the Middle East, and Carl spoke to that for a bit. Those are designed to be on-premise, so certainly behind firewalls, on enterprise servers and the like, and we can certainly have a conversation, help you with that locally to determine how to do that. So 2 ways to access. Easy answer for today is just go to esri.com/disaster, request assistance, and we'll gladly follow up and help you get started immediately. The tools are free and the solutions are free for COVID-19.
Thank you, Ryan. We have a second question for you, please. For oil and gas use case, what measures need to be considered to secure the remote plant operator stations? In another way, if a remote operator is compromised, it can lead to a disaster?
Yeah, actually, Pierre, I think that that would be better answered by our second speaker on the side. Simone was talking about oil and gas as one of the use cases and examples. So I'll defer to him perhaps to answer that question.
A good choice. Thank you, Ryan,
Yes.
for your replies. We'll move now to hear from PwC expert Simone. The first question is, how do you see the impact of increased cyber attacks in the GCC versus the rest of the world since the start of the COVID-19 crisis?
Right, and thank you very much for the question. Now, we are receiving more and more reports about attacks which are ramping up in the GCC. Now, the thing in the GCC is that a lot of the population speaks English. So basically phishing attacks, which have been used for a lot of other regions, can be applied here and are being applied here. I mean, if you look at the blunt understanding, we saw in the last period around 20% more attacks, which are basically leveraging, words or concepts which have been popularized during COVID-19. Once more, it's always difficult to give you a definitive answer because, as you may expect, not all of these things are reported, and we don't see 100% of the clients. But I mean, overall, we've seen a spike of attacks.
Okay. Can you answer the previous question I have asked Esri about? It's regarding the oil and gas. All right, please go ahead.
Yes, definitely. So look, a lot of our clients in the oil and gas space have been leveraging technologies which have been around for a while. I mean, in my presentation, I was discussing about data diodes. I was discussing about VPN connections. Now, these technologies have been there for a while. It's not something that was defined for COVID-19. They have been applied probably a little bit fast. Now, the reality is that luckily, a lot of these solutions are solutions which are decently fast to deploy. and they are external when compared to typical IT and OT infrastructure of an typical oil and gas company. So once more, it's difficult to give you an answer which covers all the possible cases, but the reality is that we have seen oil and gas clients and petrochemicals and utilities clients working aggressively in making everything happen, in leveraging these technologies, and in the worst case, when these technologies were impossible to apply, by having shifts and having different kind of social distancing solutions, basically just having the people on the ground.
Okay, I'll allow myself to add a third question to you, if you don't mind. Given the increase in sudden scale up of these remote technologies that government entities have been forced to deploy suddenly, based on your data and client conversations, have these technologies been first tested from a security perspective to configure correctly to secure information, 3, proven and scalable operational capability to ensure availability?
Yeah, okay, and that's a very fair question. Now, the reality is that the adoption of these technologies for a lot of the government entities that we see in the GCC has been extremely fast. Now, just to give you an idea, in some extreme cases, government entities were not even having laptops, right? Or basically solutions for people to connect remotely in a way which is managed by the government entity per se. So the reality is that a lot of this adoption has been done very fast. And sadly, the level of maturity of some of the governments in the GCC is relatively low when it happens to be about security. It's difficult to give you an answer which is, of course, encompassing all the government entities, all the semi-government entities, and the different size of government entities. But just to answer your question, some government entities have been doing things which are tested enough because they were already planning to do this. They just, speeded up the adoption. In some cases that we are aware of, there has been some incidents linked to very fast adoption. So this is something that is happening too.
All right. Thank you, Simone. Last but not least, we are ending this session elegantly by listening to Maha's answer. Maha, the first question from the audience to you is how China, Taiwan, Vietnam, Mongolia, New Zealand, and Australia flatten the curve of COVID-19 while the rest of the world are struggling at the moment?
Thank you. There's different measures that has been taken, especially in Asia and in China, in Vietnam, in South Korea, to flatten the situation that they have with the COVID case. But mainly China, the way that they have dealt with it is a bit different. They dealt with it in terms of that the government and the community in China, they understood that they have to have the solution itself, it has to be hand in hand, i.e. the community itself has to collaborate very closely with the government in order for them to be able to fight the spread of the virus itself. They have worked, China specifically government, they worked with the Alibaba itself, and they have worked on it in a 3 different steps, the solution that they have put in. The first solution that they worked on was related to analyzing the medical sets. And what the government in here have actually used is that they got the x-rays of an actual COVID cases. They utilized this information and the different tests, that the results of tests that they have got with the different confirmed COVID cases to Alibaba's in order for them to be able to analyze them. The way they have analyzed them by using the AI technologies in here is for them to understand if there is any test results that looks like any COVID confirmed case, then they immediately be able to say confirmly that this is, and actually this happens in seconds, and that this is pretty much a COVID case. And as a result, immediately they don't need to wait for the symptoms to happen. It immediately gets the people to be either quarantined or for the people to be tested and start the, the journey when it comes to the recovery part and the medication. So that was the first one. And I think I believe this technology, they gave it to around 1,500 laboratories across China in order for them to be able to utilize this technology. The second step that they have worked on was the mobile app that they have created. The mobile app, it had QR codes that would actually help people to move things or to move freely. By default, everybody was green except for those who have the high risk. So what happens is that
there's a result of a test that you take. And so there's questionnaires that's been taken. Once you answer the questionnaires, then a color code is given. But then the color code itself, it's given with the QR code, and it gives you the capability of restricting the movement if it happens and you have, for example, a chronic case. So if I got exposed and I have a chronic case, that gives me a high risk index. So my QR code becomes yellow. If I am, for example, I had traveled in the last 3 months, this will also increase my high risk index. And again, this would actually give me probably a red QR code. And based on these information, then my restriction as a citizen would actually move. If it happens and I'm actually healthy, i.e. I have a green color code, and then I got some sort of a temperature, this is by default, it gets me back again to yellow. If I am healthy, i.e. green color code, but I went to a high risk zone, by default, immediately it gets me to a yellow QR code. So all of these parameters, they added together in this mobile app in order for them to be able to understand to which extent or how am I supposed to deal with the citizens. So this was a second way of looking into it. The third way that they have also looked into it, that they use the cameras for the social distance. So they made sure that all of the cameras that they actually have currently for the traffic, for the accident, car accidents and so on, were utilized in order for them to be able to ensure that people have the social distance required is there. So this is also another measure that they have worked on. There is various measures that have been taken in order for them to flatten, but I think the most important one is that the awareness between the government and the citizens themselves to understand that listen, it has to be hand in hand. This is not my responsibility as a government. This is a responsibility of all of us. This is what actually ensured that the growth or the expansion or the spread flattens out. For me, I think that maturity it's what matters, and that maturity is actually what takes it into the flattened stage that we have right now.
Thank you, Maha. There's another question for you. Do the features you are explaining require users to download the Al Husn app or based only on regular network data?
Yeah. So Al Husn app, first of all, Al Husn app is not ours. Al Husn app is coming from the authority itself, from the government authority itself. Yet Adaptive Solution as a solution is a very much open system. It has the capacity to be able to integrate with anything and everything. As long as we can be able to understand the data, we can be able to digest it and add it into ours. The web app itself, the one that we have provided to the government itself, no, it's very much restricted to the telco data. It's a mashup between the telco data, the weather data, the medical data sets that we have from the health authority as well, in order for us to be able to create what I have explained in a while. That said, of course, if we have Al Husn, for example, as part of the formula, that of course will enhance the location capability. It will have more precise locations. It will give us the capacity to enrich our data as well. So definitely it can add into it, but at this stage, no, Al Husn is not added into the equation.
Thank you, Maha, for your reply. Hoping that the answers have satisfied the interest of the audience in the subject matter. Dear participant, other questions will be answered post-event by the concerned speakers at their convenience. Dear Maha, Simone, Ryan, and Carl, the UAE Ministry of Interior, the SNR Abu Dhabi organizers, our esteemed audience and I would like to thank you for your valuable participation, inspiring presentations, and your ability to present the subject matter in such interesting way. Your presentation helped us to realize how technology today is assisting the concerned public safety entities in managing the present crisis and what to do to secure the remote work infrastructure enforced on us by the lockdowns and the self-confinement bylaws. One last time, dear audience, please remember to complete the survey form that will appear in the chat box at the end of the webinar. And here I will end the webinar. Dear valuable audience, please stay tuned to our next webinar edition that will be announced in due course. Until next time, I would like to remind you to stay safe and resilient. Cheers.